Based on a comprehensive study published in BMJ Global Health, even minimal daily alcohol consumption, as little as one standard drink, significantly increases the risk of developing mouth cancer in India, with the danger being particularly severe when alcohol is combined with chewing tobacco. Mouth cancer, specifically buccal mucosa cancer, affecting the inner cheek and lip lining, is the second most common cancer in India, causing nearly 80,000 deaths annually. Incidence rates are rising, now 15 cases per 100,000 men, and 5-year survival remains poor at only 43%. The research, conducted between 2010 and 2021, compared 1,803 patients with buccal mucosa cancer to 1,903 control subjects without the disease. It aimed to untangle the intertwined effects of alcohol and tobacco, which are commonly used together in India, especially smokeless, chewing tobacco. A key focus was on the understudied health impact of locally brewed alcoholic beverages, prevalent in rural areas. Participants provided detailed histories of their alcohol and tobacco use, including types and durations. The alcohol types ranged from 11 international brands, for example beer, whiskey, to 30 local brews, for example Desi Daru, Mahua. The study found no safe level of alcohol consumption. Even drinking less than 2 grams of beer per day was linked to an increased risk. Consuming 9 grams daily, one standard drink, was associated with an approximately 50% higher risk of buccal mucosa cancer. All drinking increased risk, but locally brewed alcohol had the strongest effect. Compared to non-drinkers, any alcohol drinkers had a 68% higher risk. Drinkers of international brands had a 72% higher risk. Drinkers of locally brewed alcohol had an 87% higher risk. The combination of alcohol and chewing tobacco was exceptionally hazardous, leading to a more than 4-fold increase in cancer risk. Researchers estimate that 62% of all buccal mucosa cancer cases in India can be attributed to the interaction between these two substances. Alcohol may increase vulnerability by altering the fat content and permeability of the mouth's lining, making it more susceptible to carcinogens in chewing tobacco. Overall, the analysis indicates that 11.5% of buccal mucosa cancer cases in India are attributable to alcohol consumption alone. In high-incidence states like Meghalaya, Assam, and Madhya Pradesh, this proportion rises to about 14%. The heightened risk from local alcohol may be due to toxic contaminants like methanol and acetaldehyde, as production is largely unregulated. Despite a complex legal framework where states regulate alcohol, the local brew market operates outside these controls, with some products containing up to 90% alcohol. The researchers conclude decisively that there is no safe limit of alcohol consumption for buccal mucosa cancer risk. They assert that concerted public health action to prevent alcohol and tobacco use could largely eliminate this cancer from India. The findings underscore an urgent need for regulatory attention on unlocal alcohol and integrated policies targeting both substances to reverse the climbing rates of mouth cancer.